Good afternoon and welcome to the Assembly Committee on Health and Human Services. To everyone joining us here in Carson City, everyone in Las Vegas, and anyone joining us online. We'll start with our Secretary, will you please take roll? Let's start there.
Assembly members Dahlia. Here. Edgeworth. Here. Gonzalez. Here. Goulding. Here. Gray. Here. Hafen. Here. Hibbets. Hunt. Here. Jackson. Here. Koenig. Here. Nadeem. Yes. Wen. Here. Ortlicker. Here. Chair Brown-May.
Here. Thank you. If you will please mark the members present when they arrive. We've had people all over the building doing presentations in other committees. Okay, thank you. Once again, welcome. As a reminder, please silence your electronic devices. If you wish to testify, sign in at the table. Present our secretary with a business card if you have one. Remember to turn on the microphone when testifying and turn it off when you're done. Members of the public may provide public comment. You can do so by dialing 669-900-6833, and today's meeting ID is 869-044-75052, and then hit the pound sign. Our meeting agenda and committee information is all available on Nellis, online, and on our YouTube page. That's where everything is available. We will take public comment today at the end of our meeting. Please, as a reminder, be courteous and respectful in all of our interactions, and our members will be using their laptops and other electronic devices. Please don't take that as a sign of disrespect. Members, we have two bills on our bill hearing agenda today, and then we'll move into work session at the end. And so we will start with Senate Bill 300, which makes revisions relating to Medicaid, and we will invite forward Senator Dondero Loop. Thank you, Senator, for joining us today. Please take your time. You may begin whenever you're ready.
Good afternoon, Chair. I just ran up the stairs, so taking my time might be about an hour. Thank you. Good afternoon, Chair Brown-May and members of the committee. My name is Marilyn Dondero Loop, and I represent Senate District 8 in Clark County, and I'm honored to present Senate Bill 300, which makes revisions related to Medicaid. Existing federal law requires the Department of Health and Human Services, DHHS, to administer Medicaid. The policies within the department require that Medicaid will provide coverage for services administered by a psychiatrist, psychologist, advanced practice, registered nurse, marriage and family therapist, or licensed clinical social worker at federally qualified health centers. This is important because SB 300 codifies these provisions into Nevada law. This bill requires the director of DHHS to include under the state plan for Medicaid coverage the administration of certain medication to treat opioid use disorder. This bill aims to codify the existing federal requirement that Medicaid cover services performed by listed professionals and newly requires Medicaid to include clinical professional counselors, licensed alcohol and drug counselors, or licensed clinical alcohol and drug counselors, and a master's level intern practicing under the direct supervision of a provider of health care listed previously who practices in the same profession as the master's level intern. The most recent amendment and reprint of the bill makes certain appropriations from the account to improve health care quality and access to Nevada Medicaid budget amount to carry out the provisions of this bill. Though this is not a fiscal committee, I want to briefly mention there are other appropriations made in the bill from the state's general fund and state highway fund. I have Helen Foley in the audience to assist me with questions, and with your permission, I will call her to the table with me. Thank you.
Thank you. Welcome, Ms. Foley.
Madam Chair, members of the committee, thank you so much. My name is Helen Foley, and today I'm representing First Med. I'm the chairman of the board of First Med, which is a federally qualified health center in southern Nevada. We have 3 clinics. One is on Martin Luther King, another is on Shadow Lane, and the third is at Eastern and Desert Inn. We just started our 4th clinic because we have taken over the Child Haven contract for Clark County. We also are very privileged to serve the majority of foster children in southern Nevada. There are 3,800 of them, and we serve the majority of them. when they have a crisis, whether it's someone who has just been taken away from their family and put into child haven, or difficulties in a family setting with foster parents, those children need care right away. It is difficult to find adequate mental health professionals, but we've been able to do that, and we think that this bill will really help us do that. With FQHCs, each one has to take care of primary care, but also they are asked by the feds to select one discipline in addition to that, a minimum of one. Almost all of the services that are provided statewide for that additional service is dental. 7 years ago, when we started First Med, we decided mental health was an issue we really needed to address. And so that's what we're doing here. The national law is all of those other mental health professionals that have at a minimum of a master's level. But in Nevada, we had not yet codified the CPCs and the LADCs, which is licensed professional counselors and alcohol and drug abuse counselors. So that's what this bill does here. We thank the sponsor of the bill, Marilyn Dondero-Loop, my longtime friend, for sponsoring this. During the course of the hearings proceedings, the time had closed for anything else to be or to be a new bill. And so she asked if we could use my bill as an opportunity to do something with opioid addiction. And so you will be hearing from some of those individuals as well to discuss those sections. The only section that pertains to the FQHC is section 1.4. And again, we thank all of you for careful consideration.
Marilyn Dondero-Loop for the record. Thank you very much, Madam Chair, and we'll stand for questions.
Thank you for your concise presentation. We appreciate seeing you here today. Members, are there any questions? Okay, I do have a question. We don't have a hard copy of the bill yet, so I'm looking at it online, and I have had an opportunity to read it through. So first I want to say thank you for the really good work that you're doing to address the mental health support services and some of the areas that are missing. I'm curious to know, this piece of legislation is really directing the division to apply for a waiver and then recognizing a federally qualified health center as part of the solutions for collaborative care management services. Is that correct?
Yes, Madam Chair.
Thank you for that clarification. Okay, seeing no other questions. Thank you.
Thank you.
We appreciate you. We will open up testimony in support of Senate Bill 300. If you'd like to offer comments in support of this measure, please come forward at this time. You'll have 2 minutes. State and spell your name for the record. Thank you so much.
Madam Chair and members of the committee, my name is Dr. Keith Swanson. That's Keithswanson, and I am the medical director of the Life Change Center, which is an opiate treatment program that has 3 clinics in northern Nevada, in Sparks, in Reno, and in Carson City. I'm here today to tell you why I support SB 300 and why I feel it is of vital importance to Nevadans. I'm sure you're all aware we have an opioid crisis in this country, but we have received some good news lately. Our opioid overdose deaths in the United States dropped significantly in the past year. But unfortunately, Nevada has not seen that decline. Nevada deaths have increased. We know the opioid use disorder and other addictions are a brain disease that is chronic and, if untreated, is fatal. It is also a matter of public safety because addiction drives individuals to do whatever it takes to get their drugs. The treatment requires time and resources, including a team that is trained to treat this disease. This includes physicians, nurses, counselors, peers, as well as the administrative staff that is necessary for a successful treatment program. Treatment is life-changing, not to mention life-saving. As patients receive stability, they gain employment, become successful partners and parents, as well as contributing members of the community. A large percentage of our patients are covered by Medicaid. Unfortunately, Medicaid reimbursement rates are way below the actual cost of providing effective treatment. The key rate that is addressed in this bill has not been increased in 45 years. That's when I started practicing orthopedic surgery, was I did in 1980. I mean, that was how long ago that was. With the passage and implementation of this bill, clinics will be able to expand their staff, expand their hours, and open new facilities to provide this vital care that Nevadans need.
Thank you, Doctor. You're over your 2 minutes. I do appreciate that you have written comments. Would you mind submitting them for our secretary so that we can add them to the record?
They have been submitted.
Thank you so much. We appreciate you being here with us. Thank you for your comments. Thank you. Go ahead.
Good afternoon, Madam Chair and members of the committee. My name is Sarah Adler, and today representing Vitality Unlimited, a behavioral health provider and residential substance use disorder provider, and the Nevada Opioid Treatment Association. So SB 300 in its entirety is doing very important work. In first, over at the FQHC level, bringing in licensed alcohol and drug counselors, bringing in those SUD experts to the place where a lot of our low-income Nevadans get their health care. And second, it is increasing the Medicaid rate for opioid treatment providers so they can expand their capacity and serve those folks that may be discover the treatment is available to them through the FQHC. So we greatly appreciate your time, and we greatly appreciate the sponsor and urge your support. Thank you.
Good afternoon, committee. My name is Sabrina Schnur, SABRINA-SCHNUR, and I'm here today on behalf of the Nevada Primary Care Association, which is the state's FQHCs. We are happy to support our member FirstMed. Helen has already done a fantastic job telling you all the reasons this bill helps, so we just want to thank Senator Dondero-Loop for bringing the bill and urge your support. Thank you.
Thank you. Seeing no one else here in Carson City to offer support and no one in Las Vegas, ABH, is there anyone on the telephone line who would like to offer support for this measure?
If you would like to testify in support of Senate Bill 300, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Senate Bill 300, please press star 9 now. Caller with the last 3 digits, 202. Please press star 6 to unmute your phone. You may begin.
Good afternoon, Madam Chair and members of the committee. My name is Erin Donahue. For the record, that is Donohue. I am the Regional Director for Acadia's Comprehensive Treatment Centers, or CTCs, overseeing 3 opioid treatment programs in Clark County, Nevada. Our clinics provide vital and life-saving medication-assisted treatment to over 800 patients every day who are struggling with opioid use disorder. In Nevada, opioid treatment programs have long operated at a financial loss due to inadequate reimbursement rates, despite our services playing a critical role in combating Nevada's opioid crisis. This is why we, along with other providers, are providing testimony in support of the proposed rate increase that will support our life-saving programs. Opioid use disorder continues to be a public health crisis in the state that is getting worse. While the country saw overdose deaths decline by more than 25%, Nevada actually saw a nearly 4% increase in overdose deaths, according to the CDC's most recent data. Nevada's overdose crisis is being attributed to a surge in fentanyl use and a lack of accessible treatment, according to a report from the Clark County Opioid Task Force. With fentanyl now driving the majority of opioid-related deaths in Nevada, increasing access to medication-assisted treatment through OTPs is crucial in preventing further loss of life. Providing medication-assisted treatment requires a dedicated multidisciplinary team, including licensed nurses, physicians, certified counselors, and administrative staff. With rising personnel costs, medication expenses, licensing fees, and operational overhead, sustaining services under the current reimbursement rates is becoming increasingly difficult. The proposed rate increase is a critical step forward in providing treatment to more Nevadans, helping us address the opioid crisis that is still ravaging our state. Because of this, I urge you to support SB 300. Thank you so much for listening and for your time today.
Chair, there are no other callers to testify in support at this time.
Thank you, AVH. At this time, we'll move into opposition. Is there anyone here who would like to offer testimony in opposition on Senate Bill 300? Here in Carson City, I see no one. Las Vegas, no one. AVH, is there anyone on the telephone line who would like to offer testimony in opposition on Senate Bill 300?
The public line is open and working. There are no additional callers to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. If you would like to offer testimony in neutral on this measure, please come forward here in Carson City or in Las Vegas. Thank you. Thank you. You'll have 2 minutes. You may begin when you're ready.
My name is Teddy Craig. I'm part of Catfish Kickstart program. I'm here to support it. And on the neutral, I don't know all the medical things that they got going into it, but you're looking at a person who was strung out, homeless, and all of this, and the treatments and the programs that they're offering. I'm a project to let you know that they are working. All right, thank you.
Thank you for your comments. Seeing no one else here who would like to offer testimony in neutral here in Carson City or in Las Vegas, AVH, is there anyone on the telephone line who has joined us who would like to offer testimony in neutral?
Public line is open and working. There are no additional callers to testify in neutral at this time.
Thank you. At this time, we'll invite our bill sponsor back up. If you'd like to make, we're getting waved off. No closing comments on this measure. Thank you. We will officially close the bill hearing on Senate Bill 300. Thank you so much, Senator, for being with us today. Thank you. We'll stand in a brief recess. 1 second. Okay, we will come back to order. Thank you. That'll move us to the next order of business. We will now open the bill hearing for Senate Bill 504, and we will invite our presenter forward. Thank you.
Good afternoon, Madam Chair and members of the committee. My name is Kelsey McCann-Navarro, and I am the Administrative Services Officer for the Division of Child and Family Services. Senate Bill 504 has been a significant effort over the last 2 years with the support of Senator Rochelle Wynn and the Rural Child Welfare staff and key staff in the Clark and Washoe County Child Welfare System. The division is appreciative of the work that has gone into the development of this program, and as you may know, funding for this program has been appropriated in DCFS's budget. The measure addresses the Extended Young Adult Support Services Program, or what we call Extended Foster Care, and extends foster care benefits for youth up to the age of 21 in Nevada. The federal legislation known as Fostering Connections established the Extended Foster Care Program. It has been available as an option since 2008, and states have been implementing it since 2011. Currently, 32 states, the District of Columbia, and 9 tribes have Title IV-E Extended Foster Care. Nevada's Extended Foster Care Program is specifically designed to maximize participation across the state by making participation the default when a youth turns 18. It ensures that young adults have access to appropriate housing and supports from 18 to 21 years old, including independent living placements, kinship foster homes, and other specialized placements based on their needs. They access housing placements and approve them for safety at a minimum. And they maximize new and ongoing federal revenue by increasing the proportion of federally eligible cases among the 18 to 20-year-old participants. The program also ensures that youth receive adequate planning and monthly support from caseworkers and oversight by judges. For this population in particular, this relationship is key to a successful transition to adulthood and extend kin gap and adoption subsidies to age 21 for youth who exit at 16 or later. Now for a brief overview of this bill itself. Section 1 amends NRS 432B .9515 and the definition of a young adult. This is needed for eligibility of who qualifies for the program. This definition has to be included in state law for the Title 4E claiming allowability post 18 years of age. Section 2 amends NRS 432B .5917 to ensure youth continue to be under court oversight and adds language to ensure that the youth can opt out of the program if they choose. Otherwise, they remain under the courts without any changes to their status upon turning 18. Section 3 amends NRS 432B.592 and requires an attorney to whom a child is referred by the court to counsel the child on participation in the program as well as the options for opting out. Section 4 amends NRS 432B.593 by specifying the requirements of a child welfare agency to meet with a child who is in custody of the agency before the child turns 18. Section 5 amends NRS 432B.594 and specifies the responsibilities of the child welfare agency, the conditions for participation in the program, and certain requirements of the court. Section 6 amends NRS 432B.595 requires a written plan in collaboration with the young adult and specifies additional responsibilities of the child welfare agency in relation to the plan. Section 7 amends NRS 432B.601 and identifies the requirements for court review of the written agreement. And then sections 8, 9, 10 are just conforming sections. And section 11 is the effective date, which would be July 1st, 2025. That concludes my testimony. I'm happy to answer any questions.
Thank you for that very concise presentation. It's great to see you, Ms. Canavaro. Any members' questions? Any questions? Okay, I do have a couple. So let's look at page 7, section 6. We start with on behalf of a young adult who satisfies the requirements, and then it's in collaboration with the young adult. This is new language, adding in collaboration with the young adult. So we're developing jointly with the person that is in young adulthood as to what their plan looks like. Can you walk me through that? How is the youth that's in foster care a partner in developing what their transition plan looks like?
Councilman Canavaro, for the record, I'm going to phone a friend for program.
Good afternoon, Madam Chair and members of the committee. Betsy Crumrine, Betsey Crumrine, Deputy Administrator for the Division of Child and Family Services. The process starts when the youth turns 14 and is in foster care. They begin receiving independent living services, and then 90 days, if they're still in care at their 18th birthday, 90 days before their birthday, they participate in a transitional independent living plan where they meet with an independent living specialist to develop a budget, get their ID, develop a savings account, and make a plan for how they're going to meet the requirements of, previously it was court jurisdiction, right, which had requirements of either being in school or working or volunteering X number of hours a month. So that is a collaborative process, right, because the youth, it's really their plan. So that happens 90 days before they turn 18.
Thank you for that. Thank you. So we're starting at age 14. Like if we have a youth in foster care and a foster care youth enters the system at 10 or 12, we are obviously hoping for reunification wherever possible, right? Or placement into a permanent resident situation where potentially adoption if there's surrender, right? There's a lot of complexity around each of these cases. How are we, my question really is, right, how are we helping our youth to be able to grow into adulthood as they're nearing adulthood? So at age 14, we start with this transition program, but we're not helping them with financial planning until 18. Is that correct? Am I understanding that?
So each child welfare agency has a different independent living program, but all of the programs are similar in that the kids at 14, it's really a opt-in or opt-out. It's not required, right? But they all offer different workshops. So the workshops can be in anything that the youth that are involved in the program at the time need or identify. It might be mindfulness. It might be, budgeting if they have an allowance. It might be tutoring to help get their grades up. It might be starting to explore what kinds of opportunities they may want, in terms of employment when they get older. The youth that are involved in the independent living program really have a lot of say in what kind of workshops are offered. So it's sort of a slow transition, right, as it ramps up as they get older. And there's more discussion, probably, they're teenagers, right? So their choices change, their desires change, but really around 17, I think things they become more involved, and there's more talk about, because they have to either apply for a scholarship, or they're applying for college or a tech program, but it's that 90-day mark that really the plan needs to be solidified and signed and kind of committed to 90 days prior to the 18th birthday.
Thank you for that clarification. Thank you. I appreciate that. And so then, if a youth opts out of this program, is there an alternative time for them to opt back in during that 18 to 21-year-old time period? Can they decline it initially? Because, as you say, youth change their minds a lot, especially at this age frame, right? Mm-hmm. There's a lot of uncertainty, and while we may make a decision on Monday, it might be very different on Thursday. Is there a time for them to change their mind and opt back in?
Yes. With the Title IV Extended Foster Care Program, a youth can opt in or out as many times as they want between the ages of 18 and 21. Because, right, things change. And so the idea is not to penalize them if they, make a choice at 18 and a half to opt out, and then they can never opt back in. So it's going to be a lot of work administratively for the child welfare agencies if children are opting in and out, but they do have that option in this program.
Thank you for that. Is there a requirement, if they opt into this program, to continue along the court system? Would they still have to check in periodically with their court-appointed advisor or whoever is working through the court system on their behalf?
Yes. Youth in this program retain their court-appointed attorney during this time, and they're still under the oversight of the court. So they, at a minimum, have to have a semi-annual and an annual court hearing where their plan that they've agreed to, their education, their work requirements, their housing situation, all of that will be reviewed by the court. And the court has an option to either hold a hearing with the judge or magistrate, or they can also assign it to an administrative hearing officer. So the burden on the courts, there's some flexibility there for them as well, right? Because we're extending their caseload as well.
Thank you, Ms. Crummer, and I appreciate that. And I'll just remind you, if you don't mind, please state your name for the record every time. It just helps our secretaries keep close track of who's speaking. And my one last question is, we talk about housing and support services up to the age of 21. There a provision of support services and case management is identified in here. How robust are those support services? And you talked a little bit about a youth can opt for certain types of programming. Can you talk a little bit about how many choices are available? What's included in that wraparound support service?
Betsy Crumrine for the record. I mean, really, it is anything that the youth needs to be successful. The caseworker, case manager will be assisting them with housing, applying for benefits, filling out applications for jobs or school, connecting them with, family resource centers or basic need kinds of things, helping them figure out how to, apply for utilities if they're getting their first apartment. I mean, all of those things, right, that they have never had to do before can be on the list. And these youth really need that support. I don't think any of us who have kids have had an 18-year-old leave our house and never need us again, right? They almost need us more after they leave our homes. And so it really is a critical time for especially foster youth.
Thank you, Ms. Cromer, and I appreciate that. And I will agree with you. Having young adults in my life, they ask more questions when they leave. And so it's important to have resources. Members, any other questions? No, thank you so much. Thank you for the presentation. At this time, we'll ask you to go ahead and step back, and we'll open up testimony in support of Senate Bill 504. If you would like to offer testimony in support of Senate Bill 504, please come forward at this time. Seeing no one here in Carson City and no one in Las Vegas, AVH, is there anyone on the telephone line who would like to offer testimony in support of Senate Bill 504?
If you would like to testify in support of Senate Bill 504, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Senate Bill, please press star 9 now. You may begin.
Good afternoon, Chair and members of the committee. Leanne McAllister, MCALLISTER, Executive Director of the Nevada Chapter of the American Academy of Pediatrics, in strong support, as pediatricians know, that youth transitioning out of foster care face significant medical and mental health care needs and need all the supports described by the bill presenters. Thank you.
There are no other callers to testify in support at this time.
Thank you, AVH. At this time, we'll move into opposition testimony. If you'd like to offer testimony in opposition on this measure, please come forward. Seeing no movement here in Carson City and no one in Las Vegas, AVH, is there anyone on the telephone line who would like to offer testimony in opposition?
Public line is open and working. There are no other callers to testify at this time.
Thank you, AVH. We'll move into neutral testimony. If you would like to offer testimony in neutral, please come forward. No one here in Carson City, no one in Las Vegas. AVH, one more time. Is there anyone on the line who would like to offer testimony in neutral?
The public line is open and working. There are no callers for neutral at this time.
Thank you. At this time, we'll offer closing comments to our bill sponsor. We're getting a no. Thank you. Thank you so much for being here. We will close the bill hearing on Senate Bill 504. Thank you. Okay, thank you, members. We will now move into the next item on our agenda, which is a work session. As a reminder, our speaker has waived the rules. Okay, thank you. As a reminder, speaker has waived the rules with regard to timelines for how long between hearing a bill and work session. So we're going to go ahead and move into work session on the bill that we heard yesterday and then the two bills that we heard today. We will start with Senate Bill 257, which is the bill that we heard yesterday, and I will turn it over to Mr. Florence.
Thank you, Madam Chair. Davis Florence, Committee Policy Analyst for the record. And just for a reminder, as nonpartisan LCB staff, we can neither support nor oppose any measure before the body today. Senate Bill 257 revises provisions relating to autism, and it was sponsored by Senators Dondero Loop, Cruz Crawford, Krasner, and Orenshaw. And this was heard yesterday on May 28th. And this bill revises the statewide standard for measuring outcomes and for assessing and evaluating persons with autism spectrum disorders through 21 years of age who receive governmental services. And there are no amendments to this bill. Thank you, Chair.
Thank you, Mr. Florence. Members, I do know there was a question yesterday with regard to scope of practice, and I will defer to our legal counsel to offer the discovery on that.
Thank you, Chair. David Noss, LCB Legal for the record. So, scope of practice is a legal term of art. It is used 126 times already throughout the NRS. The vast majority of those are relating to providers of healthcare. There are a few references in the securities chapter and in the banks and financial institutions chapter where it also references it. But it is a term of art that is routinely used already throughout the NRS, and recently has been discussed by the Nevada Supreme Court as slightly related, not directly on point, but related in the Nevadans for Reproductive Healthcare Freedom versus Washington case in 2024 relating to question 6 on the ballot. The case was about whether the petition was sufficient, and one of the issues was that whether this was going to cost money, and there was no funding mechanism within question 6. And the court stated that if a provider's care fell below the standard of care, current laws and procedures for penalizing or prosecuting a healthcare provider could address such a situation, referencing Chapter 41A, professional negligence, and 630, which is the chapter for the physician's licensure. So hopefully providing some context, nonpartisan staff, neither supporting or opposing the bill, but just providing some context for that term, how it is already used throughout the NRS. Thank you, Chair.
Thank you, Mr. Nouse. And so in considering this measure, scope of practice was identified a number of times relative to autism and how that works. So the licensure board, it's my understanding, would then be responsible for identifying if that was within the scope of practice of the medical practitioner that was doing the diagnostic. Is that correct?
Thank you, Chair. Yes, that is exactly correct. The licensing boards would be in charge of policing their licensees on whether they're acting within the scope of practice, as well as if a provider is acting outside of their license, that is also practice outside of their scope and can be enjoined. So also within the research, I did find an unpublished case about that. From 2017, Hooper versus State of Nevada Board of Psychological Examiners, where a drug and alcohol counselor was performing psychological services and was enjoined from doing so because it was outside of his scope of practice.
Thank you for that clarification. Members, questions? Assemblymember Edgeworth.
Thank you. I really appreciate the background on that. Is there a place that one could look to see a list of the people with whom who have the scope of practice to diagnose people with autism?
David Noss, LCB Legal for the record. Not within the NRS. That would be a question best for the licensing boards as to, and it to some extent is also a factual determination. Scope of practice is your license, but is also your education, training, and experience. So it would be there's nothing specific in the NRS about that.
Thank you, Mr. Nouse. Any additional questions, members? See, by all means, yes.
Thank you. Back to legal, the question then. Would a practitioner very clearly know if it fell within their scope of practice if they were licensed to diagnose?
Go ahead, Mr. Nouse.
I think that's a factual determination. I'm not quite sure I can answer exactly. There's nothing specifically in law delineating who could and could not. It is a determination based on education, training, and experience. I think there's some clear examples that we could think of. A dental hygienist would have seemingly no training and experience in autism diagnosis, so that would be beyond their scope of practice. But to get into more specifically which physicians versus which physicians would not would be a factual determination.
Thank you for weighing in on that. Thank you for the questions. Members, any other questions? Okay, seeing none, I will entertain a motion to do pass. Motion by Vice Chair Nguyen, second by Assemblymember Gonzalez. Thank you so much. Any discussion on this motion? Assemblymember Edgeworth.
Thank you, Chair. I appreciate that they tried to make the scope a little bit wider. I liked a little bit more the way that it was written before because I think that was a little bit more obvious. And I will vote yes to get it out of committee, but I'm going to do a deeper dive on what exactly this would entail. For example, I am a physician and I never received any certification that said that I could diagnose autism. But theoretically, I am allowed to do that. So I just need to do a deeper dive so I understand it better. Thank you so much.
Thank you. Members, any other discussion? Okay, all those in favor say aye. Aye. Any opposed, nay. Motion carries unanimously. Thank you. I will take the floor statement on each of these today. Thank you so much. Okay, the next item on our agenda for work session today is Senate Bill 300. Members, we just heard that this morning. This makes revisions relating to Medicaid. Members, are there any questions on this measure? Okay, seeing no questions, I will entertain a motion to do pass. Motion by Vice Chair Nguyen, second by Assemblymember Gray. All those in favor say, is there any discussion on this motion? Seeing no discussion, all those in favor say aye. Aye. Any opposed, nay. Motion carries unanimously. Thank you. That leads us to the third item on our work session agenda, Senate Bill 500. We just heard that a couple of minutes ago. This one revises provisions relating to Extended Young Adult Support Services Program. Members, any questions on Senate Bill 504? Seeing no questions, I will entertain a motion to do pass. Motion by Vice Chair Nguyen, second by Assemblymember Gray. Any discussion on this motion? Go ahead, Assemblymember Gray.
I just want to say this is another one of those bills that actually does something I think really good. I am really tired of seeing kids age out of the system with absolutely nothing, no support. This is going to make the transition a little bit easier for those that need it. So thank you.
Thank you. Any other discussion, members? Okay, seeing none, all those in favor say aye. Aye. Any opposed, nay. Motion carries unanimously. Thank you. That leads us, members, to the last item on our agenda today, which is public comment. Again, to provide public comment by telephone, the number 669-900-6833. Today's meeting ID is 869-044-75052#. If you would like to offer public comment here in Carson City or Las Vegas, please come forward at this time. Seeing no movement here in either location. AVH, is there anyone on the telephone line who would like to offer public comment today?
Chair, the public line is open and working, and there are no callers for public comment at this time.
Thank you. It concludes our business for today. Thank you, members, very much. With that, our meeting is adjourned.